both doctors will be on to answer specifics on surgery or anesthesia. Any other questions on this?
So little Beckham, cute little 6-year-old child, we're going to be correcting his flat foot. In the pediatric world, there's a couple different ways that we can do this, and the procedure we've selected is a HyProCure. Okay, we'll look here at little Beckham's feet. So Beckham's here to have a procedure done. And Beckham, I've seen you for a while now, and we were putting orthotics on this feet. And we just have a foot that kind of crushes here into the ground and creates some discomfort here. And all we're going to do is do a procedure here that's going to kind of pull that foot right back up underneath you. And this was that procedure again we talked about, the HyProCure. And in a HyProCure procedure, it can kind of be a one and done method to correct a pediatric flat foot that's flexible. And so there's some qualifying factors we're obviously looking for in these pediatric patients to say, yes, they're candidates, they're good candidates, and to ensure that we have a successful outcome. But I really do like these procedures because, one, they are very successful. They have very low recovery times. And in the event that there are complications, that the implant is not working or we're not getting the outcome, they're actually very reversible, easily reversible, and where we can get the child right back to walking just like they were before the procedure. And so these become very ideal procedures for these young children that are struggling with these flat feet. If we just go over some of our instructions today, I think we picked out a color for cast. What color was that? Green. That'll be a good color. So when we wake up, keep the cast on, dry, clean, and intact. I'll see you in 2 weeks. We'll take that cast off, and then we'll put you right into a walking boot.
We ended up getting referred by his pediatrician. He was complaining of ankle pain when he was really active. We started off with some orthotics, and then we eventually made our way this route. We're wanting to see him get to be as active as he wants to be without having that ankle pain.
The foot and ankle pain would be nice to go away.
Yeah.
When we are initially evaluating children in the office for flat feet, it's always conservative. We're always putting orthotics on them. We're trying to manage their symptoms and manage the severity, but it's always going to be orthotic management. We find ourselves in positions like this today where we're trying to do something a little bit more aggressive. And that's just because these children are either struggling with orthotics still, meaning the orthotic just can't control that foot, or we're looking for something different, meaning we're looking for an alternative to orthotic management. We're looking to fix it, not treat it. And that's exactly why we're here today, is we're looking to try to fix this pediatric flat foot. So in these kids that have this flexible flat foot, and this pronation, we'll call it, it's really due to a lot of, we call ligamentum laxicity. So there's a joint right below the ankle joint called the subtalar joint. You see that there's an arch to the foot, but as soon as he starts to stand, that foot just flattens right out. And that's where you're seeing the inside of the arch collapse. This foot rolls out. And what's going to be fascinating is when we put a HyProCure in there, that foot's going to sit just like this. So as it loads, it's going to load underneath him and not roll out like that. And that rolling out will create tendonitis here on the inside. There's a large nerve here on the inside that crushes and creates a lot of pain in these kids. And so by just holding that foot underneath them, it will stop this pain or correct that foot so that these kids can then walk and run and jump without having all this discomfort here. The HyProCure is just a beautiful intermediate because you can put these in younger children and get incredible outcomes with them. And you're only having to put a cast on them for 2 weeks and they're in a boot. So you have a 3-week recovery, where in a flat foot reconstruction, you have a minimum of 4-month recovery for one foot, and then we have to do the other one. So you can find that doing a flat foot reconstruction is a year-long process. Now, they're not down for that whole year, but in that year, there's no sports, no athletic activities. Whereas in a HyProCure world, you can take these children and it's only 2 months from start to beginning for both feet where they can get back to athletic activities. All right, so if we're looking at this foot here, radiographically, what we're trying to look at is the placement of that implant on the talus. And so the head of that implant is flush with that sidewall of the talus. And that is where you want it to be to stabilize this unstable joint. The HyProCures are game changers because they're non-invasive. They are incredibly powerful. Powerful is that they create really good correction and they solve real problems. These procedures are not done for aesthetics. It's not just to make the foot look better. It's to make it so this foot doesn't hurt anymore. And at the end of the day, that's what we're trying to accomplish, is just how do we get these kids so they don't have painful flat feet. And then again, going back to this, if it isn't successful, it is unfortunate, but it's reversible. And we find that the patient satisfaction with these implants is really, really high. And so it therefore becomes a very favorable procedure to perform in these pediatric patients. All right, so everything for Beckham's case went great. No problems, no complications, very smooth case. I do feel that one of the most common issues with this procedure in the community in general is maybe experience. It is important to understand is that not every doctor that does these does the same technique. And also some of the warning signs when kids are struggling with these, the doctor's intention is they want a good outcome, and they sometimes may let these problems kind of like marinate a little longer than they should before removing them. But again, at the end of the day, these are wonderful, powerful, fabulous procedures that can really change the quality of life of these children that are struggling.